Now, Britain has sounded the alarm as the Omicron COVID-19 variant spreads quickly across the country. The variant has been detected in about 40% of all infections in London. There are fears 1 million people in the UK could be infected with the strain by the end of the month, unless action is taken. The rising caseload is putting pressure on the country's already strained healthcare system. Prime Minister Boris Johnson has warned the UK could face a tidal wave of infections. He's declared an Omicron emergency. Mr Johnson has announced plans to expand booster jabs to all adults and has set the target to administer 1 million doses a day.
What we now know about Omicron is that, first of all, that it's spreading at a phenomenal rate, something that we've never seen before. It's doubling every 2 to 3 days in infections, and that means we're facing a tidal wave of infection. We're once again in a race between the vaccine and the virus.
Ollie Barrett joins us live from London. Ollie, administering 1 million doses a day, how big a challenge is that?
It's a huge challenge. It's never been achieved throughout the entirety of this pandemic in previous vaccination rollouts, first and second doses. And so all stops are going to have to be pulled out to get there. And the government is not at all clear that it will indeed achieve this target, but it does want to set that target as high as possible to get as many jabs into as many arms as possible, as quickly as possible. The highest rate we've really seen throughout the previous rollouts of vaccines so far has been up around 800,000, the very peak at that point. And so, as I say, there really will have to be a huge commitment on behalf of the health services here, but also volunteers are being roped in again to help administer the vaccines and also deal with paperwork and bureaucracy. We're also seeing the military being used as well to try and get as many doses out as quickly as possible. The government is also being clear that it is going to have to, in the health service, see some other routine procedures and appointments taking a backseat here as it prioritises the booster campaign and the rollout of as many vaccine doses as possible over some other health procedures.
And the government also thinks it's necessary to support that with restrictions that have just been reintroduced before the holidays.
Yeah, the government would not want you to call them restrictions. It would call them measures that are precautionary. And so what we're seeing as of today is working from home guidance being brought in for people who are able to do so. We're seeing face masks made mandatory in more settings where public spaces are seen with gatherings of people. We're also seeing the introduction of COVID passes for access to some venues like nightclubs. That's a very controversial idea, not least in Boris Johnson's own Conservative Party. But they're not strict vaccine passports in the sense that your COVID pass can also be evidence of a negative COVID-19 test. Boris Johnson, though, is being asked today, the UK Prime Minister, about whether he can rule out needing tougher restrictions before Christmas as a result of the rapid spread of Omicron. He says he cannot make that guarantee.
All right, Ollie Barrett in London. Thank you.